Hey there, Dr. Michael Lepore talking to you on Whiteboard Wednesday about preventative treatment in order to try to avoid an invasive procedure. And so we're going to talk about some things that really have an impact on keeping patients away from a procedure or away from the operating room, away from the endovascular suite, which is really our goal as vascular surgeons, is to try to stay away from that. But ultimately, we have those tools when we need to get there and try to improve quality of life, quality of patients' ability to get around, move around, walk, obviously avoid stroke prevention, all of those different types of things. Genetic predisposition is very important when it comes to figuring who needs to be screened and who does not need to be screened. I've discussed before in some of the other topics, somebody who's got a family history of aneurysm in the family, whether it's abdominal aortic aneurysm, thoracic aortic aneurysm, they really should be screened with a simple ultrasound of the aorta just to make sure that they don't have some early changes with regards to that. Anybody who's got a family history of hypercholesterolemia, meaning, aunts, uncles, mother, father, anybody kind of in the family, really obviously the immediate family, has had problems with vascular disease at a young age, possibly coronary artery disease at a very young age. Those patients should be looked at more quickly with regards to screening. Again, aortic screening, carotid screening, lower extremity arterial screenings. We do a very simple triple screen where we look at the carotids, the aorta, and ABIs, which is ankle brachial index, to see if somebody has some baseline issues with regards to their circulation that is an indicator of possibly other things that are going on. Obviously, if somebody's already being treated for coronary artery disease, they probably should be screened for vascular disease as well. Risk factor modification is very important, and by the time the patients get to us, if they already have vascular disease, not uncommonly, they're patients that have underlying cholesterol problems, diabetes, maybe they are actively tobacco users or have a long history of tobacco use. We're trying to change some of those things in terms of managing the things we can. You can't run from your genetics, so we have to just make sure that those patients have been identified and they're on the right medications to help them in advance. Typically, they've been seen by their cardiologist or their primary care doctor, and they already are. But when we see them, sometimes they're not, and we will go ahead and get some of those things on board. A diet is a heart healthy, heart smart diet. We could have a whole entire session about different diets, vegetarian diets, healthy, heart smart, and whether it's a Mediterranean style diet, vegan diets, all these different diets that are out there that are available. But most importantly, it's going to be the things that we all know just aren't really great for us. Unfortunately, they're the things we really like to eat: burgers, fries, greasy foods, creamy types of things over the tops of foods, fatty steaks, all these other things that just taste great, but they're just not great for us. So it's really common sense. But again, if you stick pretty closely to a Mediterranean style diet, that's going to keep you relatively heart healthy, heart smart. Exercise I've talked about before with regards to getting on an exercise program, but not just to get on an exercise program. It becomes important to controlling your cholesterol and as well as blood sugar, especially for our diabetic patients that really are trying to keep that under control and stop this from progressing. And again, avoiding an invasive procedure, because that's the goal. We're trying to do that. And then medications, whether it's antiplatelet medications, pretty much any patient that has a blockage in, say, their carotid arteries, their coronary arteries, their lower extremity arteries, those patients should all be on at least a baby aspirin. And sometimes if they've been treated, they may be on clopidogrel or Plavix or some other antiplatelet agent. Statin drugs, again, a whole nother conversation beyond the scope of what we're talking about today, but it helps to control cholesterol along with the important heart healthy, heart smart diet, which would be imperative. And blood pressure control is going to be of utmost importance when it comes to preventative care. Preventative treatment is a way, again, to avoid a more invasive treatment. As we've discussed, genetic predisposition has a big role, and early screening is important in those patients. Risk factor modification to change some of these habits that are just not really good with regards to the vascular system, and diet, heart healthy, heart smart, as we've talked about before in other talks. Exercise to basically maintain your exercise, control these things, and certain medications that have been shown to be proven to help in the control of cholesterol as well as the treatment of vascular disease. Again, Dr. Michael Lepore here with you today on Whiteboard Wednesday from Sarasota Vascular Specialists.